Hello out there in television land, and welcome to yet another edition of It's Your Health, the fastest 30 minutes in television history, right, sweetheart?
Right, sweetheart.
I'm with my bride, and we'll be back after this brief commercial message. Remember, check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. And
any of the things.
We'll be right back. Welcome to the first segment of It's Your Health. And before we get started, I need to tell the listening public out there how much we appreciate the cards, mass cards, letters, notes that we received over the past month. It was a very twisted July.
Flowers.
Yes, flowers. It was a very twisted July when we lost my first wife, Martha. And the next day, the passing of my younger brother, Patrick. So although there was not a public display of sympathy, the personal ones that those out there provided to us, to our family, I opened up every card personally, read them, shared them with other family members, and it really meant a lot to us. So.
Absolutely.
So that being said, let's get started.
Okay. I have a question for you. That's how we're going to start.
All righty.
Can taking vitamin D supplements or spending more time in the sun help prevent Alzheimer's and other forms of dementia?
Maybe. We're not sure. I can tell you there's an epidemic of vitamin D deficiency out there. And of course, we don't want you sitting in the sun and getting premature aging and putting yourself at risk for skin cancer. And patients who are using sunscreens, by the way, they're not getting vitamin D in them as well. So I would take a vitamin D supplement, usually 1,000 units every day should be sufficient. And it's certainly going to help. Some patients actually get their vitamin D levels measured and will require prescription vitamin D. That's usually 50,000 units twice a month.
Oh, I thought you were going to say $50,000.
Oh, no. It'll save you $50,000 because if you break a hip, that's bad news. So yes, vitamin D is important.
Okay, I have another question.
I'm ready.
It's said that folic acid supplements improve cognitive function in older adults. Could those with Alzheimer's disease benefit from folic acid?
Well, that is an interesting question. And when we see patients with dementing illnesses or Alzheimer's-like illnesses, one of the reversible things that can be looked at is vitamin B12 deficiency. And the cousin of vitamin B12, of course, is folic acid. And so routinely in our playbook, we would be measuring those. And you would be surprised how many people out there in television land are deficient in vitamin B12, for which you would require a shot. Usually the oral supplements don't work. And folic acid. And so those things are very crucial, I think, for brain health.
And how can you buy folic acid to take?
I'm not sure you can. It is a prescription, the real deal. They probably have some watered down supplements, but if you really need it, it would be a prescription.
And does it have side effects?
No. The B12 and folic acids are water soluble, so it's pretty hard to overdose on those. You generally pee them out if you don't need them, so not a big issue. Okay.
Our next one is a headline. High blood pressure may not be all bad in the elderly. Developing high blood pressure in very old age may provide some protection from dementia. In middle age, high blood pressure, also called hypertension, boosts dementia risk later in life. It raises your risk for heart attack and stroke. But in the 8th or 9th decade, it was linked to a decrease in mental decline in one's 90s.
Right, and I think this is something that we're seeing. It's just kind of new age stuff. When you're young or younger, we want the lowest blood pressure you can tolerate. However, as you age, we are now finding that it's best to have a little higher blood pressure so that the blood can go where it's supposed to go. And apparently, if you overtreat someone who's elderly with blood pressure medications, it puts them at higher risk for falls And so bad things can happen. So I wouldn't be afraid to let an elderly person's blood pressure go a little higher.
That's an interesting concept.
Yep, yep. Too much of a good thing is no good.
I heard that too much of a good thing is wonderful.
Oh, really? You must have heard that from me.
Oh, next information is about adult vaccination. It's low with minimal improvement in recent years. Only minimal improvements have been made in vaccination coverage among U.S. adults in recent years.
And that's a problem. And as crazy as it sounds, we were visited by our drug representative this past week and says, well, your shipment of flu shots are going to be coming in. I'm saying, what? How fast the summer goes. We're already talking return to school and flu shot time. It's just unbelievable. Here's a list of vaccinations that most adults should be looking at because they can prevent disease. So look at that list, check with your doctor, make sure you're up to date on vaccinations.
Okay. Here's a good question. In fact, I just went for my exam and my doctor said to me, you're doing fine, but if you have any bleeding, call us immediately. And here's someone who had a question. I thought I was in menopause because I haven't had a period in 3 years, but last month I suddenly got my period again. What about vaginal bleeding after menopause?
It's a problem. It may not be a big problem, but it needs to be looked at and addressed. I can recall 1 or 2 patients in my career who ignored it, and these things went on to bad things, and it really cost them their lives.
Oh, my goodness.
If you have bleeding from any orifice, particularly the birth canal, after menopause, get it looked at, get it attended to. You need a diagnosis. Don't wish it away or think it's going to go away.
I think it's just a period.
Right, exactly. It's abnormal to have postmenopausal bleeding. And as I said, it could be something benign, but by the same token, it may not be. So you really need to not ignore that.
Okay. Are we talking now about patients unaware of statin use?
You know, this is kind of interesting. People who we put on statins, which I kind of love, I think they're great medicines.
And explain what they are, first of all.
Statins are medications that reduce cholesterol, kind of like Lipitor, Pravachol, Simvastatin, Zocor. They're revolutionary drugs. Now, they're not for everybody, I'll agree, but patients who start on these, we will get calls almost within a couple of weeks saying, my legs hurt, which they can cause. It's kind of out there that they can cause muscle aches and pains. Not joint, but muscle aches and pains.
My sister had that.
It turns out that if you don't tell a patient they're taking a statin, they did a study, these people didn't get muscle aches or pains.
You're kidding.
Right, so you wonder if they're reading it on the internet or talking to friends and all of a sudden they have aches and pains that were induced by the statin, but it really wasn't. It was kind of like a placebo effect in reverse.
Huh.
So the other issue is if you do get muscle aches or pains, you might want to add on coenzyme Q. But you also should consider getting your CPK muscle enzymes evaluated, because statins can cause real CPK muscle enzyme elevations, which would be bad for you and your kidneys. So,
CPK.
yeah, creatinine phosphokinase, CPK.
Oh, okay. We'll go with CPK.
Right.
Another question. We've got a lot of questions since last time.
You're very inquisitive today, sweetheart.
Yes, inquisitive.
Oh, inquisitive, that too.
Are there any proven Alzheimer's prevention strategies? And I hope you say yes.
Well, there are. Keep in mind that some dementing illnesses are vascular in nature. So it goes back to basics: blood pressure, diabetes, cholesterol, lifestyle. All of those things factor in. And the reverse is true. You may be subject to a dementing illness if your blood pressure is out of control, uncontrolled diabetes, high cholesterol, smoke, not active, social isolation,
Isolation.
Isolation.
Yeah, that's why he has me.
A walking thesaurus. Okay, I told you it was fast, and we're already at our first break here. So
Oh, my goodness.
we'll be right back after this brief commercial message. Remember, you're watching It's Your Health. We're your leader in healthcare information. We'll be right back.
Welcome back to It's Your Health. And of course, I have more questions to ask the doctor. And so we'll get right to it, right?
Right, dear.
And you'll be very interested in this one. Can stress cause hair loss?
That is interesting.
You've been really stressed, haven't you?
35 years of medicine, 5 kids, a couple of wives. Yeah, I guess so.
A couple of wives.
Me stressed. Well, there's various forms of hair loss. Stress can be the common denominator in all of them. It does interfere with the cycle of hair growth. And some people kind of play with their hair. And I remember a kid in grade school who I guess was under stress, and he used to pull his hair out. And so there are...
Pull it out by the roots?
Right, there's actually a pediatric syndrome of that, but it can progress in adulthood where you're twirling your hair or you're pulling it out. But nevertheless, to answer your question, the answer is yes. The opposite may not be true. In other words, once you relieve your stress, sometimes hair will grow back.
Oh, it will?
Yep.
Well, let me see how I'm going to relieve my stress.
There you go.
Okay, next question. Will my vision deteriorate after cataract surgery?
Well, you would have cataract surgery to actually improve your vision. And
That's what I thought.
And I've not seen anyone really have a deterioration in their eyesight after cataract surgery. It should improve unless there's a problem with the surgery, or if there's a coexisting problem with macular degeneration or glaucoma. You may have a coexisting issue that may not improve after cataract surgery.
Well, I've heard that after cataract surgery they implant something and you have terrific vision.
Yeah, it's revolutionary, the lenses that they put in these days. So I think as a sidebar to this conversation, most people are not getting their eyes checked on a regular basis, and I think that's very crucial. Your eye health is important, as is your dental health and things along those lines.
I have a dental appointment next week.
Very good.
Okay, another question. Is sunscreen from last year still good? When
Is
does
this
it...
directed at me?
Well, that would be from 3 years ago. When does sunscreen expire?
It's pretty resilient. It can last up to 3 years, although most sunscreens will have a expiration date on it, like most things. So, I mean, sunscreen's kind of cheap, so why don't you just go out and get some new sunscreen? Okay.
And, you know, on one of our previous shows, we went and discussed the better ones, the better
Right.
sunscreen. So if you go back and go on the app and go back to one of our previous shows, you'll find which are the best sunscreens that you can buy.
Oh, yes.
Our next item is something I don't know anything about, and I admit it.
Cooking? Cleaning? One of those things. Go ahead. I'm sorry.
No, and you're not sorry, so don't say you are.
All righty.
What is PPI?
Okay, that is an interesting question. PPIs are proton pump inhibitors. They are revolutionary, widely prescribed. A lot of people are on them.
It's a pill?
It's a pill that reduces acid in your stomach. We use it for reflux, heartburn, Protonix, Nexium, Dexilent, Omeprazole, all those ones. They're even over the counter now. And they were celebrated as terrific drugs. And they were revolutionary because they really do relieve heartburn symptoms, cut down on acid. But for every reward, there's a penalty. They're coming under fire now for increased side effects, such as increased fracture risk, Some vitamins may not get absorbed into your system because of these medications. You may become anemic, and part of the recent concern was that if you have a heart condition and you drop your blood count, your heart rate may go higher, you may have more atrial fibrillation, congestive heart failure, readmissions to the hospital. And here's this funny thing. A third of people out there in television land, 1 out of 3 who are on these medicines don't need them and shouldn't be on them. But they're popular drugs, people like them because they get some agita, some heartburn, and once people start on these, it's very hard to get them off because they think they need them. 1/3 of you out there don't need them, so you really need to reassess your need for this proton pump inhibitor.
I like to drink grapefruit juice. Personally, I don't. But I hear that it can interfere with prescription medications. Is that true?
There's no doubt. If you're on a prescription medicine, grapefruit juice will affect in some way, shape, or form the metabolism, the distribution, and potential side effects of that drug. So as a rule of thumb, if you're on prescription medicine, do not, under pain of mortal sin, drink grapefruit juice.
Any prescription medicine?
Anyone, because it's going to affect it one way or another, some more than others. For example, cholesterol medicines, blood pressure medicines, but by and large it's going to affect most medicines you take because of the metabolism of the grapefruit juice and the medication you're on.
What about other citrus drinks?
Shouldn't be a problem. Shouldn't be a problem.
Huh. So it's only grapefruit juice?
And probably grapefruit itself, even though...
Oh, yeah.
Yeah, so you'd want to stay off that.
You're not a pediatrician, but we'll ask you this question. Should more kids get their tonsils out?
Well, that's a tough one. Probably. You know, when we were growing up, everybody got their tonsils out. Now the pendulum swung back and it's more conservative. I think for selected cases, repeated infections, abscess formations, yeah, I think there's a role for getting your tonsils out. As we say, when in doubt, take it out.
Get a lot of ice cream when you get your tonsils out.
There you go.
And Jell-O. I remember that. It was a long time ago. Now I have quite a question for you. This is really an out there one. How often should you, meaning me, wash your bra?
Why? I didn't even think that would be an issue. I mean, it's kind of like how often you wash your underwear, because that is an undergarment. Apparently, some people don't, or put it off for some time. So I would say, geez, daily. What do you think? I mean,
Well, the average is once a week.
oh my!
That
No kidding.
some people go longer than that, but once a week is probably reasonable.
All right, well, that being said, we were going to take a break after this one. So we'll be right back after this brief commercial message. Remember, you're watching It's Your Health. Welcome back to the third and final segment of It's Your Health. Philip Benyo with his bride, right?
Right. What's so funny about that?
I don't know. It just sounded funny. Your bride.
I ran into some of your patients, of course, coming in, and they stopped me and said, "Are you Dr. Benyo's wife?" And I said, "Yes, I am." They said, "We know you by your voice."
Oh.
Because I said hello to them when they came in, and they said that's how they knew me, that I have a distinctive voice.
Oh, I see. You're not doing something on the side over the phone, are you?
No,
Okay,
no, nothing like that.
Just checking.
Okay, let's do headlines instead
Alrighty.
then. This is an interesting one. In fact, we have some of this at home. What is coconut water? And what's behind the hype? I mean, everybody is selling coconut water.
I kind of think it's a fad. Keep in mind, it's really not coconut milk. It's coconut juice. So
What's the difference?
well, it's people must think that they're actually taking the juice from the coconut
Yeah.
and drinking it. In point of fact, they're not. It's water and coconut juice, just like grape juice or orange juice.
Oh.
So it's a fad. I'm not sure there's any tremendous health care benefits. I think you can just stick with plain water. You're going to get some extra calories. It could be a little pricier. So I'm not so sure it's a big deal.
So stick with plain water.
I would. And then put the lime in the coconut, remember?
Yes, I remember. And what
Saying
comes next? You
you
put
put
the lime in the coconut
And mix it, drink it all up.
down or something
mix
like
it all
that.
together.
Whatever.
And call the
People
doctor.
Don't, yeah.
Okay.
Doctor. All right. Meat-linked chemical levels tied to heart risks. A molecule produced in the digestion of red meat, eggs, and dairy products is linked to an increased risk of a fatal heart attack or stroke. What is this all about?
Yeah, they found this chemical called trimethylamine nitrous oxide.
TMAO.
Right. And this actually causes blood clots, if you will, or causes platelets to clump together, which could be an inciting factor for a stroke or a heart attack. You know, everything in moderation, but this really casts a doubt on someone who, you know, maybe you should get a little bit more veggies in your diet, fruits and vegetables, rather than processed meats and meats in general.
But you make such good steaks.
I do. I take that medicine. I take that chemical out when I make your
Oh,
steaks.
do you?
Yeah, I do.
Oh,
Don't worry
well,
about it.
that's good. Okay. Hot chili peppers may extend life. You'll like hearing this. Hot red chili pepper consumption is associated with a 13% lower risk of death.
You know, I've been doing this 35 years, and I have my own poll of seeing guys, particularly who are 85, 90 in nursing homes or even at home. And there's three things that are common to their longevity after speaking to them. First is hot peppers. Second is red wine. And third is sex. So that's on
So
our
how
menu.
many of those have you got?
That's 2 out of 3 ain't bad, right?
Oh, listen to this. Okay, we're going to change the subject.
Alrighty.
We're going to talk about caffeine. People who drink between 3 and 5 cups of coffee daily may lower their risk of Alzheimer's, dementia, and Parkinson's by up to 27%.
Yep, caffeine is not bad. Again, everything in moderation. We're going to put a screen up there to show you where caffeine is hidden in certain things like coffee, cola drinks, teas.
Espresso.
Right, and energy bars and the like. So that gives you a vague idea of how much caffeine is out there. So speaking of what's out there, again, we've proven the fastest 30 minutes in television history. So
Absolutely.
thank you for joining us and allowing us to come into your homes and inform and hopefully entertain you. Remember, we're It's Your Health, your leader in healthcare information. Say goodnight, Gracie.
Good night, Gracie.